Hi, my name is Pim Dahan. I'm a GP partner at Hodge Family Practice. We've made this video for a few reasons really. The first of which is to thank our patients for their support and for bearing with us during this quite difficult time during the coronavirus. There have been a lot of changes to our lives really, with the way that we interact with our friends and our loved ones and the way that we may seek medical help and support. But we want to reassure you that we are still open. We are still here to help you. The way that we consult may have changed quite a lot. We're not seeing many patients face to face. Most things are now done on the phone, and we are able to deal with most conditions on the phone really well. But we do have access to online now, so we can do video consultations, and you can also email us if required. We have noticed that some patients may not be contacting us, either because they think that we're really busy, that we're not going to have time to speak to them, or that they may feel that we may bring them in and therefore put them at risk of catching corona. However, what I would say was that we will make time for you, and that if we did need to see you, we would do that in a time and place that was safe and convenient. Nationally, we have noticed that there have been fewer people being referred for symptoms that may point towards cancer, for example. So I wanted to take a few moments really to talk about some of the symptoms that shouldn't really be ignored by going through some of our body systems. So if I was to go through firstly our bowels, it's important that if a patient was to notice any fresh blood or any bleeding from their back passage, or a change to the bowels for more than 6 weeks, for example, if it's looser or more frequent, to contact us so that we can kind of go through that together to make a plan. Certainly our female patients should still continue to examine their breasts. So if they were to, for example, find a lump, or they had changes to the skin of their nipple, or any discharge, I would be calling up my GP practice to kind of get some advice and some support in regards to that. Again, with our female patients, if they noticed any abnormal vaginal bleeding, for example after intercourse or after menopause, that is something that shouldn't be ignored, and to call their GP and to call us to kind of get some advice. It's becoming a lot more sunnier now, and certainly normally we would find people ringing us in regards to changes to their skin, for example their moles or any blemishes. So for example, if you had a mole and you noticed that there was a change in its size, the shape, the colour, any sort of change in sensation, for example it's itchy or bleeding, please call us to kind of get some help. At the end of the day though, if something doesn't feel right, you have symptoms such as weight loss without any cause, any bleeding, for example any blood in your sputum or in your urine, or a lump in your testicles, please pick up the phone. As I've said, we will make time for you. Most patients with these symptoms actually won't have a cancer, but if you were to contact us, again it gives us a chance to kind of go through your symptoms together and to make a plan of action. I hope this video has been helpful, and to reiterate, we are still open, we are still here to help you, so if you have any concerns, please pick up the phone. Please continue to follow government advice, so stay home, protect the NHS and save lives. Thank you.